This plane brought Taiwanese evacuees home from a quarantined cruise ship in Japan hit by the coronavirus. While their plane and all luggage gets a thorough disinfection, the evacuees will be isolated for another 2 weeks. These precautions are the new normal in the fight to contain the coronavirus. In Italy, top officials meet after the virus claimed its first victim in the country. An elderly man in northern Italy died after being hospitalized. The number of cases spiked to 17 in just one day. In Codogno, a town southeast of Milan, officials shut down schools and businesses.
They've issued an official order to close down all the shops, and we're following the order, so we're closing. There's a lot of alarm, and that also worries me.
We are old and very concerned. I am 76 years old. I live on my own. I really don't know what to do.
Public events are banned, and that includes church services. The first patient to contract the virus here had met a friend who had recently travelled to China. But the World Health Organization is worried about another trend they have spotted in the latest infections.
Although the total number of cases outside China remains relatively small, we're concerned about the number of cases with no clear epidemiological link, such as travel history to China or contact with a confirmed case.
In Ukraine, local residents blocked buses with passengers evacuated from China. These scenes prompted President Zelenskiy to give his fellow citizens a dressing down on television.
These are our Ukrainians. They're not sick with plague. They don't have horns and hooves. They are ordinary, normal people.
He promised that the organisers of the blockade would be prosecuted. Authorities are working to contain the fear of the virus as well as its spread.
For more, I'm joined by virologist Martin Sturmer in Frankfurt. Professor Sturmer, thanks for joining me. The Director General of the WHO, as we just heard in that report, has said they're concerned about some new cases that may not have a link to China. A second person has just died now in Italy. How worried should we be?
We should be worried about these cases because they make it more difficult to control the spread of the virus. The reason is they do not fit into our case definition, and therefore they might not be tested or maybe tested delayed, so they can spread the virus in an uncontrolled way.
The WHO has also warned that the window of opportunity to contain this epidemic is closing. What should governments around the world be doing?
Yeah, we heard about Italy, so they do quite restrictive measures, and that might be one way to be alarmed or be aware in controlling the virus or the spread of the virus, and even be more careful in looking into the traffic from and to China, and making people coming from China, making them more aware to look at themselves, to do not go out and go to a festival or somewhere else. And if I come back from China, please stay at home for 14 days and be sure that you do not get ill and carry the virus somewhere else.
And what about in China? I mean, are there signs that the outbreak there has peaked?
Just looking at the numbers they report, it might be. However, they've changed their case definition 3 times in 8 days. So it's very difficult to rely if this is a true numbers of people carrying the virus. So I'm not sure whether this is a peak.
Is there a vaccination for this virus within reach?
They are working on it, but I would expect it at least in June to July, and even then it has to be tested in a small number of patients before you can use it widely. So it's difficult. I would not expect it in the next weeks or month.
Right. And how likely then is it that this epidemic is going to be labelled a pandemic?
It depends on how the situation in Italy might change. Actually, we heard about 17 cases. If they are not able to control the spread of the virus, then we have the definition for a pandemic.
Martin Sturmer speaking to us from Frankfurt. Thanks very much for the update.
You're welcome.